The British consumer goods giant's opioid marketing scandal. When you think of the opioid crisis that devastated American communities throughout the 2010s, certain names immediately come to mind. Purdue Pharma and the Sackler family dominate headlines, their aggressive marketing of OxyContin becoming synonymous with corporate greed and pharmaceutical malfeasance. But lurking in the shadows of this crisis was another player, one whose story reveals perhaps an even more cynical exploitation of human suffering. Reckitt Benckiser, the British consumer goods giant known for household brands like Lysol, Durex, and Mucinex, orchestrated one of the most audacious schemes in pharmaceutical history. Between 2010 and 2019, this company didn't just profit from the opioid epidemic. It actively participated in creating the crisis while simultaneously positioning itself as the solution. Through its pharmaceutical subsidiary Indivior, formerly known as Reckitt Benckiser Pharmaceuticals, the company engaged in a calculated campaign of deception that would ultimately cost American taxpayers billions of dollars and leave countless families shattered by addiction. The story begins with Suboxone, a medication containing buprenorphine and naloxone that was genuinely revolutionary in treating opioid addiction. Approved by the FDA in 2002, Suboxone represented a breakthrough in medication-assisted treatment, offering hope to millions struggling with opioid dependency. Reckitt Benckiser acquired the rights to Suboxone through its 2014 acquisition of the specialty pharmaceutical company that would become Indivior. The medication worked by partially activating opioid receptors in the brain, reducing cravings and withdrawal symptoms without producing the euphoric high associated with other opioids. However, what should have been a genuine public health advancement became the centerpiece of an elaborate fraud scheme. Reckitt Benckiser recognized that Suboxone represented a unique business opportunity, a chance to profit from both sides of the opioid crisis. The company's internal documents, later revealed through federal investigations, showed executives discussing strategies to expand the market for opioid addiction treatment, not by addressing the root causes of addiction, but by ensuring a steady stream of patients who would require their expensive medication. The first phase of Reckitt Benckiser's scheme involved the systematic expansion of opioid prescribing practices that would create more addicted patients. Through carefully orchestrated marketing campaigns targeting healthcare providers, the company promoted the off-label use of opioid medications for conditions where such treatments were inappropriate or excessive. Company sales representatives were trained to downplay addiction risks and emphasize the safety of opioid treatments, using misleading scientific studies and cherry-picked data to support their claims. Internal training materials instructed sales teams to target specific physician specialties, including family practitioners and pain management clinics, with aggressive promotional tactics. The company spent millions on continuing medical education programs, medical conferences, and speaker fees for physicians who were willing to promote expanded opioid prescribing. Between 2010 and 2014, Reckitt Benckiser's pharmaceutical division increased its marketing budget for opioid-related products by over 300%, with the majority of funds directed toward convincing doctors that opioids were safe and effective for a broad range of conditions. Federal investigators later discovered that company executives had established specific targets for increasing the number of Americans taking prescription opioids, treating human addiction as a market opportunity to be cultivated and expanded. Simultaneously, Reckitt Benckiser was positioning itself as the primary solution to the very crisis it was helping to create. The company's marketing strategy for Suboxone represented a masterclass in corporate cynicism, exploiting vulnerable populations while maintaining a veneer of public health advocacy. Marketing materials emphasized Reckitt Benckiser's commitment to addressing the opioid epidemic, with executives making public statements about the company's dedication to helping Americans overcome addiction. However, internal documents revealed a different reality. Company strategists had identified the growing addiction crisis as a massive business opportunity, projecting that the market for addiction treatment medications could reach several billion dollars annually by 2020. Sales representatives were instructed to target physicians working in addiction treatment centers, emergency rooms, and criminal justice facilities, precisely the locations where victims of the opioid crisis were most likely to seek help. The company developed sophisticated patient identification programs using prescription databases and insurance records to identify individuals who had recently been prescribed opioid medications, then directing marketing efforts toward their healthcare providers. The deceptive practices extended far beyond simple marketing misrepresentation. Reckitt Benckiser engaged in what federal prosecutors would later describe as a systematic campaign of fraud targeting government healthcare programs, including Medicaid, Medicare, and veterans' healthcare systems. The company submitted false and misleading information to government agencies regarding Suboxone's safety profile, effectiveness compared to alternative treatments, and appropriate patient populations. Internal communications revealed that company executives were aware that many patients prescribed Suboxone did not meet clinical criteria for the medication, but continued promoting expanded prescribing practices because it increased revenue. The company established a network of supposedly independent medical experts who were actually paid consultants, using these individuals to publish research studies and medical recommendations that supported broader Suboxone prescribing. Between 2012 and 2018, Reckitt Benckiser paid over $40 million to healthcare providers for speaking fees, consulting arrangements, and research funding, with payment amounts directly correlated to the volume of Suboxone prescriptions written by individual physicians. Federal investigators discovered that the company had created detailed profiles of thousands of doctors, tracking their prescribing patterns and adjusting financial incentives to maximize Suboxone sales. Perhaps most egregiously, Reckitt Benckiser deliberately targeted vulnerable populations who were least able to advocate for themselves or recognize predatory marketing practices. Company sales teams were specifically directed to focus on physicians serving low-income communities, rural areas, and populations with limited access to comprehensive healthcare services. The rationale was cynically simple. Patients in these communities were less likely to seek second opinions, had fewer treatment alternatives available, and were more dependent on government insurance programs that would reimburse Suboxone prescriptions. The company developed specialized marketing materials for physicians working in criminal justice settings, promoting Suboxone as an alternative to traditional rehabilitation programs despite limited evidence supporting such claims. Internal documents revealed company executives discussing strategies to influence state and local government policies regarding addiction treatment, lobbying for regulations that would favor medication-assisted treatment over counseling, social services, or other comprehensive approaches to addiction recovery. The company spent over $15 million between 2013 and 2017 on lobbying activities designed to increase government funding for Suboxone treatment programs while simultaneously reducing funding for alternative addiction treatment approaches. The financial mechanics of Reckitt Benckiser's fraud were staggering in their scope and sophistication. Government investigators eventually determined that the company had systematically overcharged federal healthcare programs by hundreds of millions of dollars through false pricing information, kickback arrangements with healthcare providers, and fraudulent claims regarding patient medical necessity. The company established a complex web of subsidiary organizations, patient assistance programs, and medical foundations that were actually designed to circumvent government regulations limiting pharmaceutical marketing practices. Reckitt Benckiser created fake grassroots organizations that appeared to be patient advocacy groups but were actually funded and controlled by the company to promote Suboxone treatment. The company's internal financial projections, revealed during federal investigations, showed executives calculating the lifetime value of addiction patients, treating human suffering as a renewable resource for generating pharmaceutical revenue. By 2016, Suboxone and related products were generating over $1.5 billion in annual revenue for Reckitt Benckiser, with profit margins exceeding 80% on many government sales. Federal auditors later determined that taxpayers had been overcharged by approximately $1.2 billion between 2011 and 2018 due to the company's fraudulent billing practices and deceptive marketing claims. The human cost of Reckitt Benckiser's actions extended far beyond financial fraud. federal prosecutors presented evidence that the company's deceptive marketing practices had directly contributed to increased addiction rates, overdose deaths, and family destruction across American communities. Patients who had been inappropriately prescribed Suboxone often experienced severe withdrawal symptoms, required long-term medication dependence, or suffered complications from drug interactions that company representatives had failed to disclose to healthcare providers. The company's aggressive marketing of medication-assisted treatment as a substitute for comprehensive addiction counseling and social support services undermined evidence-based recovery programs and left many patients without access to effective long-term treatment options. Internal company research, which was never made public, showed that a significant percentage of Suboxone patients did not achieve sustained recovery and often returned to illegal opioid use within 2 years of beginning treatment. Rather than addressing these findings by improving patient support services or refining prescribing guidelines, company executives chose to suppress the research and continue promoting expanded Suboxone use. Federal investigators documented cases where Reckitt Benckiser sales representatives had encouraged physicians to prescribe Suboxone to pregnant women despite known risks to fetal development, and had promoted the medication for adolescent patients without adequate safety data for pediatric populations. The investigation and prosecution of Reckitt Benckiser's fraud involved multiple federal agencies working over nearly a decade to unravel the company's complex scheme. The Federal Bureau of Investigation, Drug Enforcement Administration, Department of Health and Human Services, and Department of Justice collaborated to analyze thousands of internal company documents, interview former employees, and trace financial transactions across multiple countries and corporate entities. The breakthrough came in 2017 when a former Reckitt Benckiser sales director became a federal whistleblower, providing investigators with detailed information about the company's internal marketing strategies and fraudulent billing practices. This individual had personally witnessed company executives celebrating increased addiction rates as business opportunities and had been instructed to falsify safety data in presentations to government healthcare officials. Additional whistleblowers came forward throughout 2018 and 2019, including physicians, pharmacists, and addiction counselors who had been approached by company representatives with offers of financial compensation for promoting Suboxone despite clinical concerns about patient welfare. In July 2019, the walls finally closed in on Reckitt Benckiser's elaborate scheme when federal prosecutors announced a comprehensive settlement addressing the company's role in the opioid crisis. Reckitt Benckiser agreed to pay $1.4 billion to resolve federal criminal and civil investigations into its fraudulent marketing practices, making it one of the largest pharmaceutical fraud settlements in American history. The company pleaded guilty to federal felony charges, including conspiracy to commit fraud against government healthcare programs, and admitted to engaging in deceptive marketing practices that contributed to the opioid epidemic. As part of the settlement agreement, Reckitt Benckiser was required to divest its entire pharmaceutical division, including Indivior and all opioid-related medication assets, ensuring the company could no longer profit from addiction treatment medications. The settlement funds were designated for addiction treatment programs, overdose prevention initiatives, and reimbursement of federal healthcare programs that had been defrauded by the company's billing practices. However, legal experts noted that the financial penalties represented only a fraction of the total profits Reckitt Benckiser had earned through its fraudulent scheme, and no individual executives faced criminal prosecution despite clear evidence of personal involvement in the illegal activities. The case highlighted fundamental weaknesses in corporate accountability systems that allow multinational companies to treat criminal penalties as routine business expenses while shielding individual decision-makers from personal consequences for their actions. The Reckitt Benckiser scandal serves as a chilling reminder that corporate greed can transform even genuine medical breakthroughs into instruments of exploitation and human suffering. This British consumer goods company, trusted by millions of families worldwide for everyday household products, deliberately chose to profit from one of the most devastating public health crises in modern American history. The company's executives didn't simply fail to prevent opioid addiction, they actively cultivated it as a business strategy while positioning themselves as the solution to problems they had helped create. The $1.4 billion settlement may have closed one chapter of accountability, But it cannot restore the lives lost, families destroyed, or communities devastated by this calculated campaign of corporate malfeasance. Today, as America continues struggling with the ongoing consequences of the opioid epidemic, the Reckitt Benckiser case stands as evidence that some of history's most harmful corporate crimes are perpetrated not by obvious villains, but by seemingly respectable companies willing to treat human misery as a market opportunity to be exploited for profit.